Are medications like Cialis and Viagra the best interventions to improve erectile dysfunction?
Well, I think the answer is it depends. Okay, so it depends on where you are in your journey of erectile dysfunction. I think it depends on what your goals of sexual pleasure are, if there's any other health issues going on.
Yeah.
So erectile dysfunction can be complicated, right? So we talked about all the things that can cause it. Now, I would say that Viagra, Cialis are great starters, and hopefully they are the great enders for a lot of people where they don't need more. However, there are a lot of people out there who cannot get a good erection with with Viagra or Cialis, or they cannot take Viagra or Cialis. Nitrates are are a medication for heart. If you get chest pain, they are vasodilators, and you put the nitrate under your tongue if you get chest pain. That is a direct contraindication for using Viagra or Cialis. You cannot use that medication because it can lower your blood pressure enough that you can have a heart attack or stroke and potentially die. So if you are
Hmm.
on nitrates, Viagra and Cialis is not an option for you. If you had a prostatectomy or you have just poorly controlled diabetes or something like that, and Viagra, Cialis are not working anymore, I'm not going to tell you, sorry guys, there's no other options. There's other excellent options. They include things like intracavernosal injections. Those are injections directly into the penis that you do about 10 to 15 minutes before you want to engage in sexual activity. That's a local medication. So like people with nitrates, it's safe to take because it's not spreading through the rest of your body. And it's also a very powerful, potent thing because unlike Viagra and Cialis, which goes throughout your body, and it's not like the movies where you take the medication and then you get an instant boner. You have to be aroused, right? Viagra and
Yeah.
Cialis improves blood flow throughout your body, including your penis. So when you get a good erection, you get a better, stronger erection. Now, the injections into your penis, they're literally bypassing your brain, right? So you're injecting that directly in your penis, and it's a very potent vasodilator. It's usually Trimix, it's 3 vasodilators that go directly into your penis. So obviously, we tell you to start engaging in sexual activity, but you're going to get an erection. Now, the biggest risk for this is something called a priapism, an erection that lasts longer than 4 hours. The chances of getting that are very low as long as you follow the directions appropriately, but that's also a good option. If that doesn't work or you don't like injections, there's things you can add to Viagra, Cialis, or the constriction or the injections, like what we call a cock ring, which is a constriction band and a vacuum erection device. These things have been
Hmm.
known to be very helpful as well, where you're bringing blood into the penis with the device, and then once you have a full penis, you put a constriction band onto the base of your penis, take off the device so your penis is hard and the blood is trapped. You can use that with Viagra, Cialis, the injections. And then if that doesn't work, there's also the penile implant, which I'm a specialist in. And the penile implant is an excellent procedure where it's about an hour to an hour and a half where we make a small incision either on the top of above your penis or in your scrotum, and we place a device completely inside your penis that you can have a pump inside your scrotum like a third testicle. You pump up your penis to get hard again like you were 18 years old, full sensation, full orgasm, and no one can really tell the device is inside you, and that's something that's in for life. Now, the difference with the penile implant is that you can't go back to the other things. Once you have something in you, it's in you for life. And so there,
Yeah.
as you can see, there's a lot of different options. Oftentimes you can start with the oral meds, but that you don't have to. If you are interested in an implant and you want to talk with a doctor, you can go ahead and do the implant. If you're interested in the injections, we can start you on the injection.